Thanks.
Hi, everyone. Good.
Hey,
Good
Ben.
afternoon. I love that the discussion has already gotten started. That's great.
Sorry.
Well, Ben,
I got
it's me and Bernie again. We were here yesterday, right? With you?
Yeah. No, this is wonderful. How's it going, everybody?
Great.
Give folks another minute or two.
Hey, Enrique.
Hey, how are you? Good to see
How
you
are
all.
you? There's a few folks I don't know. I don't know Amy. And a lot of folks, actually. So I'm going to stop at that. I'll stop with the folks I do know.
I think this is small enough, and I believe we have 20 or 30 minutes or so that we can do a round of intros. And I can call people out Hollywood Square style. So I'll start. I'm Ben Stang. I'm the Director of Healthcare Workforce Strategy with Social Venture Partners Connecticut, and I'm supporting OWS on all things healthcare. And I'll just go through how I see folks on my screen. Bernie, would you like to go?
Sure. Bernie Park, SVP partner, working with Governor's Workforce Council and OWS on all things healthcare, assisting them.
Thanks, Bernie. Sal Mancino.
Yeah. Hi, everyone. Sal Mancino, Vice President of Human Resources at Stanford Health, participating in a variety of these programs and really looking forward to get this off the ground. Thanks, Ben. Thanks, Bernie.
Thank you, Sal. Enrique.
Yeah, Enrique Juncarelia. I'm the Director of Workforce Solutions, collaborative in Metro Hartford, and we are a member of the National Fund for Workforce Solutions.
Thank you. Amy.
Sure, I'm Amy Porter. I'm the Commissioner for the Department of Aging and Disability Services.
Thanks. Paulette, great to see you again.
Hi, how you doing, Ben? Paulette Fox, I'm Executive Director of Opportunities Industrialization Center, and we work with youth between the ages of 18 to 24 and allied health.
Great. Diane.
Hi, everyone. I'm Diane Bordenero. I'm a Chief Regional Workforce Development Officer for CT State Community Colleges, and I cover the campuses in the capital area and the eastern part of the state. I'm also a nurse, so I'm passionate about healthcare and healthcare education and really happy to be here.
Thank you, Diane. Ty.
Good afternoon. I'm Ty Talley Rushing. I'm the Site Manager and Senior Career Navigator at the American Job Center in Stamford.
Great. Marcia.
I'm Marcia Proto, Executive Director for the Connecticut Center for Nursing Workforce and the entity who will be submitting one of the applications to the federal DOL for the nurse expansion, and that's going to be for the faculty.
Thanks, Marcia. John.
Hi, I'm John Murphy, the CEO of Nuvance Health, which is a 7-hospital system, 4 of which are in Western Connecticut.
Thanks, John. Ellen.
Good afternoon. I'm Ellen Econs. I work for the Department of Mental Health and Addiction Services, as well as the Bureau of Rehab Services, which is under Aging and Disability. I am the Employment Systems Manager.
Great. Needs no introduction, but Mark.
Hi, everyone. I'm Mark Argash, Chair of the Governor's Workforce Council and Executive Director of Social Venture Partners.
Thanks. Vicki.
Hi, Vicki Pizzuto, Executive Director for Career and Transfer Readiness for the Connecticut State College and University System Office.
Okay. Michelle.
Good afternoon. I'm Michelle James. I'm the Executive Director of the Community Action Agency with the Anti-Poverty Agency serving the 25 towns in Western Connecticut.
Great. Tracy.
Hi, good afternoon. Tracy Tremblay. I'm Community Impact Initiatives Manager with United Way of Southeastern Connecticut.
Wonderful. Nancy Taylor.
Hi, everyone. I'm Nancy Taylor. I'm the Director of Workforce Development for Charter Oak State College, and we are one of the recipients of a Career Connect healthcare grant.
Taylor.
Hi, everyone. Taylor Spurlock. I'm a Governor's Fellow working with the Office of Workforce Strategy. I support Ben on a few of our healthcare projects and also work on our education and career pathways initiatives.
Thanks. Malia.
Thanks, Malia Seavey. I work at Ready CT and a Career Pathways Site Director for Eastern Connecticut, working with the Eastern Workforce Investment Board.
Thanks. Carol.
Carol Heller, Bank of America, and very interested in investing and partnering in the healthcare industry, workforce development.
Great. Tim.
I'm Tim Larson. I'm the Executive Director of the Office of Higher Ed.
Farron, hope I got that right.
So it's actually Astrid Farron-Poole.
Okay.
I'm the Chief of Staff and Equal Employment Opportunity Administrator at DSS, Department of Social Services.
Great. I'll acknowledge that CTN's on the line. Karen.
Hi, Karen Quisnell, on the Career Connect program, OWS. Thanks.
Thanks, Karen. And Misty.
Hi, I'm Misty Martinek. I joined OWS this week as the Fiscal Administrative Assistant.
Great. Thank everyone for being here. I think we have a good room, in a room that got started before the conversation even came about. So I think this would be a good call. So just to kick it off, and feel free, maybe we can do, if you want to answer, just raise your hand. I can call on folks. So what are the specific challenges to attracting talent in the sector? And maybe I'll ask the healthcare employers to take a first stab at that one. So the challenges that you're seeing in attracting talent.
Want us to raise our hands, Ben, or?
You know what, Sal, just go for it.
Okay, yeah, thanks. Sal Mancino again, Stanford Health. Yeah, challenges are that these groups of individuals that we're really looking to focus on, I think, are ideal for a future in healthcare. Ben and Bernie and I are on a different committee, and I firmly believe there's just we need an education to. Not everyone has to be a nurse or an accountant. You know, there are so many great jobs, and so my challenge right now is hiring or recruiting individuals in that entry level range that ranges from the traditional, okay, housekeeping, that's become almost like the standard. Well, that's not the standard. You know, I need individuals who can be receptionists and schedulers in medical offices and technicians and imaging techs, all great jobs. And what I've been facing is, on average, each month, I get about 10 individuals who say yes to a job who just don't show. They either don't go to the physical, a few fail the physical, totally get that, but won't show up for orientation, and they literally say, yeah, no, I got no job. And I've never seen before in my 20 years here at Stanford. So that is a new phenomenon. And that's really in that group that what I'm going to call entry level, but I don't mean that to be a negative connotation. So I have to interview like 20 medical assistants to hire one or two, which is, again, new. This is new for us.
So it's like losing staff due to follow-up.
Or I don't know what their level of interest is, or do they really want to work in healthcare? Or are they going to get a job, because it pays 50 cents more an hour, when we have a real robust career with a pension and benefits and PTO? We just need to get that word. And all of my colleagues up and down the coast in Connecticut, hospitals are a great place to work. They really are.
Yeah. John, I'm interested if you're seeing similar phenomenon at Nuance.
Yeah, I think
and also, I'm sorry, real quick, I'm not sure who's sharing their screen right now. Mark, I think you started screen sharing. Thanks. John, you can carry on.
Yeah, I would say I also feel that the challenges are real. My own sense is that the workforce shortages are so significant at the present time that when somebody comes in and they're looking at their colleagues and their peers and seeing them run faster and harder than they would have imagined, and they're doing it because they're short-staffed, our first-year turnover rate, our first 90-day turnover rate is much higher than it's ever been, because I think the environment is less welcoming than it should be or could be. I also think another factor is, at least what I'm hearing from younger people, including my own children, that they really like the schedules to be flexible. I don't think as hospitals, we're very good at that. We tend to be historically pretty rigid, 7 to 3, 3 to 11, whatever it is. And you do a 12-hour shift, particularly for bedside care. And then lastly, I would say, because the shortages are real, we have to redesign care teams. And the people that we've tasked with redesigning their care teams have grown up in very traditional models. And I don't think they have a great deal of experience, or for that matter, you can't play around at the bedside carelessly. And you also have organized labor where if you're going to redesign responsibilities, a fair amount of that has to be negotiated, which is difficult, time consuming. So I think that these are all very real challenges.
Thanks, John. I believe there are folks from DEMIS and DSS in this call. I'm not sure if you're involved at all in the hiring process within your agency, but I'd be interested to hear from you as well.
I'm not, this is Ellen Econs. I'm not involved in the hiring process. I am more involved in helping folks or helping our providers get people employed and working with the employers in the community. So it's real important for me to hear these things.
Thanks, Ellen. Tim, I see a raised hand.
Yeah, thanks. Not so much in the hiring end, but the education end, if you will. So the Office of Higher Ed has responsibilities of the licensing and accrediting of the independent colleges, as well as the occupational schools, such as Stone Academy, Porter and Chester, and Lincoln Tech. Those three occupational schools have, somewhere in the neighborhood of 2,000 healthcare related programs, LPN, CNA, MA, and the like. One of the challenges that we find with them is trying to find clinical placements for those students in order to accommodate the hours that are necessary to certify. As well, during the pandemic, we needed to increase the availability of using simulators to sort of account for some of that clinical hour and activity. So that is a big concern with many of the schools that are trying to, deliver certified nursing staff. So it's something that, we're starting to try to work on with the Hospital Association and using some of the surgical centers, if you will, as potential facilities for some of those clinical hours. Our intent would be to try to find a directory of available clinical sites across the state of Connecticut so that we could fortify those opportunities and make sure that they're available and well tracked.
Thanks, Tim. I see Marcia has a hand up.
Just very quickly going along with Tim's concern, it permeates any kind of healthcare provider. The Connecticut Center for Nursing Workforce for 7 years has had its own clinical placement model, which we built. We've been very successful in working with Stanford Health, Mary McKiernan, and the 4 schools of nursing, really being able to manage their matches. We just entered a contract with Hartford Healthcare and are now working with 11 of Hartford Healthcare's brick and mortars. They want to merge on to long-term care, home care, primary. But right now, all of the Hartford Healthcare sites have loaded in all of their clinical placements. All of our schools who have contracts with Hartford Healthcare properties have reached out and secured them. And now this week, they're going to be loading up all their students. I sent Ben and Bernie a little email as a quick peek. We realized that there's quite a few opportunities at some of the smaller hospitals within the Hartford healthcare system, but the larger ones don't have as many. So I think we're going to find some unbelievable hidden capacity, Tim, that goes along with your concern, that there are organizations that have clinical capacity, and maybe it's not the right time, et cetera, that those students are during the daytime. But I think our schools are going to really have to flex to get those students in. And then I also think we're going to find out that some of the facilities will look at their sister facilities and saying, oh, I never thought of opening up this unit or that unit. So I think we're going to be able to increase clinical capacity. And so this goes right hand in hand with the Connecticut Health Horizons, where we're trying to increase student seat capacity for nursing. I think we're not going to have that much of a shortage. We'd clearly love to work with Yale, and I was talking with Beth Beckman about this before she left. But John, I would love to engage your nursing leaderships at Nuvance, as well as I'm working with Prospect Medical Holdings to talk about this as well. So exciting things happening. Lessons learned. We'll be able to share a lot of great data by probably March of 2023.
Thanks, Marcia. I know, John, do you want to say anything to that?
No, we'd be happy to receive any suggestions.
Great. I know we're going deep on clinical placements right now. I'm going to let Amy go, and then I just want to get back to if there are specific challenges that we see in attracting talent into the healthcare sector. So Amy?
Yeah, thank you. I just was responding, Ben, to your question earlier about the state agencies. So our state agency doesn't have, we don't have any healthcare professionals, but I do sit with the other health and human service commissioners on a regular basis. And this is one of the issues that they bring up. And the same things that John was talking about, you know, the challenges being able to find the talent, the number of people you actually have to be able to interview, the need for flexible schedules and what that looks like. They're the same issues that are permeating the state hiring as well. So I know that we're struggling in a lot of areas. So I just wanted to add that to your question.
And I want to give our training and education providers in this room a chance to talk, because I know you guys are seeing cohorts of students come through your pipeline, and just interested if you find any sort of disconnect in the way that you're trying to prepare your students to be placed into healthcare jobs.
So Ben, I can start. You know, we are definitely experiencing challenges trying to find clinical placements. We have seen significant shifts since the pandemic. We find a lot of our acute care hospitals are now looking to take CNAs for clinical training, where before they were always in long-term care, which is interesting. You know, that's great for the CNAs who want to work in a hospital, but I think that's really leaving our long-term care facilities struggling because it's not quite as sexy to be, you know, in the long-term care as it is in the acute care facility from the student's perspective. You know, it seems to be, you know, really a challenge over and over and over. And we have not gotten back to having the number of clinical hours for our students in our unlicensed programs, the CNAs and the sterile processing that we had pre-pandemic. So
you're feeling the pinch on clinical placements as well, just to have seats.
yeah, absolutely. You know, where we used to maybe do 48 hours of clinical training for a CNA, now we're lucky if we can get 24 in, you know.
Got it. Paulette, I know you do a lot of training as well. Is this coming up in what you're seeing at OIC?
Yeah, and thank you, Ben. I think because we're funded by Capital Workforce Partners under the Workforce Innovation Act, one of the things that Dr. Murphy said is that the scheduling, if you are really going after those clients that have kids, we could not place some of our youth for internships, which is a major part of the WIOLA contract that we pay for because of the time. And the hospital would not bid. It either had to be 7, and these particular clients, especially females, don't have a backup until the schools or daycares are open, but especially the schools if they have school age kids. And then the other problem that I'm having with the interns is a lot of that 18 to 24 did not take the COVID shots. So all your hospitals now are requiring the booster. And I'm in a time squeeze and trying to get these young adults to, okay, you got to take your shots, you got to do that. So we, as we recruit now, we're actually telling people, we need you to have the 2 shots and take the booster before we can do any kind of placement. So I think we got to get on the same page and all of the programs, because these young adults talk and they also are easily turned off. And also, this is the age group that smokes a lot of marijuana, and they don't understand that when they take the drug test, they're still confused. So a lot of them are saying, well, I just won't go into healthcare then if I can't smoke. So I think we need to do some better education around that and what hospitals expect. And we take it from the approach like, people drink, but you can't drink and go to work. That's just something you can't do.
Thanks, Paulette. I think that's a good segue into what some of the challenges are for hiring non-traditional talent. Oh, I'm sorry, Enrique, do you want to respond?
Thank you. Just a quick comment to link 2 of the themes that have emerged in the discussion. And one is the idea that we cannot really train and place new people in our pipelines to solve the staffing problem. The scale of the shortage is too wide. But at the same time, you describe issues of job quality like scheduling and many others. And that is crucial, I think, to review and revise our assumptions and question our assumptions on the basis of how our organization is addressing the needs of the workforce so that they will stay. If you do a quick comparison between the pipeline of new entrants into that labor market, the existing pool of that workforce already active, and then you add the reservation potential candidates that are licensed and out in the community but are not participating in that labor market, you would realize that there is room for us to tap into a potential workforce that would address at least some of those needs.
Thanks,
You know,
Enrique.
it's like the market for gold, where the production of new gold is a tiny drop in the bucket compared to the inventory of the existing gold available in the world. So
Yeah,
that's
no,
called a reservation demand. Yeah.
thanks, Enrique. So let's talk about what some things that employers could do to bring on talent, and especially non-traditional talent. Like if there are any organizational changes. I think that's what the panel sort of highlighted, right? The work that Accenture is doing, some of the work that's happening in the reentry pool, and interested to hear everybody's reactions to that and where they think that plays a role in healthcare.
And I can just make a suggestion. One of the things that has come out of some of our regional sector partnership discussions is tied to what John was mentioning about redesigning care teams and really looking at the way we give care from a different perspective. You know, how much can be delegated to some of these lower entry level positions, because we just don't have enough nurses to go around, and it's going to take some creative reworking of, you know, exactly who does what and what can be done safely. You know, I think that is really a key to, you know, moving forward and making sure that there is that person, a live person at the bedside. It may not always be a nurse, but at least it's eyes and ears that can report back to the nurse. Yeah.
Thanks, Diane. Anyone else on some of the challenges of hiring non-traditional talent in the healthcare field and what we could do to promote that?
Yeah, Ben, I was gonna say, I think, you know, higher education needs to do, maybe needs to pivot a bit, you know, and do some things that we previously haven't really been teaching people, all the things that we always, you know, higher education is accustomed to people being in degree programs, you know, bachelor's degrees, associate degrees, master's degrees. And I think a lot of what we're hearing from employers right now is that for people who are not going into that college track, we need to be able to teach them those skills that, you know, I think as one of our speakers in the panel said, they would previously had gotten in a college education. And so really kind of pivoting and thinking about what are the things that we need to be teaching them and what are the types of courses that we need to be designing. And also the fact that we all know the statistics, and all of us on this group who are in higher education know that there's the trend that says people just don't want a 4-year degree anymore, or even a 2-year degree. You know, the college degree is really changing. And so to really pivot and start offering micro credentials, which I know all of us are doing, but to really work with employers and say, what are those critical skills that you need? And as someone else said, these are not soft skills. And I know that none of us in the higher education world have deemed them as soft skills for years, because we don't think they're soft skills at all. But to be able to actually teach a course in, you know, communication skills and, you know, how do you talk to patients? How do you build teamwork and things like that? Those are things that actually can be taught. And so we need to figure out, how do you do those 6-week courses in something like that? And I think it's, you know, a lot more of being more closely aligned with employers to be able to do that, to really find out what their needs are. And I also think for, you know, for a long time, higher education has sort of been in the business of saying, this is what we offer for degrees, instead of saying to employers, let's sit down with you and find out what you need. And I know, Diane and I and a few others on this call this week, and Marcia and you, Ben, we were at this meeting, the regional sector partnership to get the healthcare group going in Hartford, and heard a lot from employers and what they needed. And I know around the state, we're hearing a lot of that. But I think we as higher education just need to do more of that and do more listening tours to find out what does everybody need from us, and not, this is what we have, and really figure out what are those micro credentials that we can be teaching everyone.
Thanks, Nancy. I see Malia has a raised hand, and then I also want to go to the two large employers we have in this group and hear your thoughts on different micro credentials and such, but I'll let Malia go first.
Thanks, Ben. And as you know, sort of I'm a very new person into this space, but working in Eastern Connecticut, and have had a number of conversations with the area high schools, sort of looking back at that population. And just from the small conversations that I've had with the high schools is the challenge that they're having around even being able to find the individuals who are then certified to be teachers, so that they can even offer CNA programs, et cetera. So I'm not sure how that quite fits in here. I feel like there needs to be a space for, okay, how do we actually make sure that there's the people to train them when it comes to high school? So I wanted to just sort of throw that out into the discussion. Apologies if it doesn't quite fit here, but wanted to make sure that it was put out there.
Thanks, Malia. And we got two raised hands from your comments. So it was a good comment. Diane?
Sure. I just want to also point out that we are starting to see a little bit of re-entry population get hired into healthcare. Before it was a hard and fast no. And, if you haven't considered it for your business, there have been some really amazing success stories. And if you have seen someone who has been released from prison and gone through a CNA program and get that, that certificate, and, know that they have a job on the other end of it, it's the most heartwarming feeling, that you have had in a long time, honestly, really, just to see someone feel like they have a second chance. So if you haven't considered this for your business, it might be, another way to look at filling some of those empty positions. We are working with CRI to really, get people moving.
Thanks, Diane. Tim?
Yeah, I just want to comment that going back to these occupational schools, I've had the president of the three presidents of these occupational schools speak during COVID to Garrett Moran, and they're not at the table, and I don't know why. And then last March, our office ran an event at the Mohegan Sun Arena. We had 2,500 high school kids from 70 high schools around the state of Connecticut for free walk around at what effectively would have been a career fair. Electric Boat picked up 500 names of interested students at that career fair. The Mohegan Sun picked up 300 names. So we let them use it as sort of a job fair, but it also introduced the fact that not everyone's going to go to a 4-year or 2-year college, and it presents a great opportunity for people to explore other opportunities. We have 18,000 kids enrolled in 85 of these schools, paying $25 million of tuition. So there's a market out there, and there are opportunities for employers to contact these schools because they all have obligations for placements if they want to continue to grow. Just the thought.
Thanks, Tim. Vicky, I see you have a raised hand.
Yes, this is to Commissioner Larson's point about the proprietary schools. There may be a challenge with those folks, at least in the healthcare perspective, is that for those graduates of those programs, often the challenge is if they do want to progress along the career pathway, the programming, for the most part, is not transferable, and they must start pretty much from the beginning, not to mention the correlation between the debt they incur in some of these programs. So that may be part of the answer as to why it's more difficult to get the participation in those programs and for them to be moving forward. I'm not sure if anyone else would want to comment.
Thanks, Vicky.
This is Marcia. The 3 LPN schools are very active in the Council of Deans and Directors. So we do have Stone, Porter, and Chester and Lincoln very active, as well as their nursing leadership.
John and Sal, I want to go back to you guys on challenges of hiring non-traditional talent, and if this is something that your health systems are looking into, if there are any organizational changes that you've considered.
I think for our physician practices, you know, we're doing split shifts. We're looking at job sharing. I think that there's a competency of technical skills that I think middle schoolers have around computers and technology. So that's not it. But it really is understanding and having a passion for patients. That is getting individuals from a non-traditional background, that this is healthcare and you do it as a vocation and you have to want to do it, and it's not just a job. So because as Dr. Murphy said before, we're seeing record new hire turnover as well. People don't like it. I just won't go back, and you just didn't see that. But we have to take it. You know, we have to invest more time. I mean, this is a pool of talent that we need to focus on and change where we can. So those are some of the things that we're doing, and we are training differently in certain areas. Some of the online training works better, but clearly we are around flexibility of scheduling. We are changing schedules where we can, as long as patient care is not impacted.
Thanks, Sal. Dr. Murphy?
Yeah, I would agree with Sal. We're trying everything. We have a number of programs where, you know, we are working with some of the high schools trying to design, as some of you have talked about, apprenticeships where you know, younger people come in. First, we talk to them about what healthcare is like, give them entry-level positions. And as you say, from non-traditional careers or backgrounds. And then I think we have to be a little bit more adaptive in terms of, so how do we apply them, as opposed to saying, this is the job description, either you fit it or you don't. I think we have to look at the tasks that need to be accomplished and say, all right, so this is the talent pool, you know, we got to make this work. And I think in terms of non-traditional, many of you have said, and I would agree, we have to get into the minds of young teens and, you know, start introducing what healthcare is to them. But I do think we have to listen more. As an example, I think one of the things we're not doing very well is using technology to automate some low-value work that really could be done predictably, and let those who really want to be with patients, who want to connect with patients, get rid of some of the stuff that we could automate. So some of the non-traditional workers, I think, could help us figure out how to do that. And I just think we have to be a little bit more open-minded about who can help us get done what we need to get done, as opposed to, you know, creating these archetypical positions and saying either you fit it or you don't.
Thank you. I think there's been a lot of talk in the panels about different partnerships. We saw what's happening at Hartford Healthcare, Ready CT, and Hartford Public Schools. I guess, and this is another question for Sal and Dr. Murphy. What supports would you need from partners to address systematic and cultural change? I think we have a good host of folks from education here. So how could education, training providers, et cetera, build programs to fit your needs for hiring?
I think we talked a little bit about some of that today. It's just, you're preparing them for the workforce, preparing them for that professionalism and sophistication of patients. You know, the customer's always right. You hear that from Stu Leonard's, right? But with patients, and you have to really be patient with patients and their families. So it takes a special person to work in healthcare. And so I think that's one of the most important things. I think the technical skills are there. It's really those, and I agree. Someone said soft skills. I don't like that word. I know it sounds pejorative. I think to work in healthcare, you need to want to work here and understand that this is a special place to be, and treat that with the respect, because that could be your mother or father that people are caring for.
Thanks, Sal.
I guess I would add, in terms of education, I think that, and I'm sure the educators already realize this, that the notion of interdisciplinary participation and cooperation and collaboration is more important now than ever. When I went through training, I was taught that this is what doctors do, and you give people orders, and that's not the way it works. So that I think when we deal with our most complicated patients, we do have to help both young physicians, young nurses, young social workers, that this is a team sport, and they need to be comfortable interacting and learning from each other, and that the solutions often lie outside of understanding how the kidneys work, and that you need to know how society can help these folks, whether it's with jobs, with housing, with getting them the appropriate visa, whatever it might be, or helping them with language, or helping them with addiction. But my point really is that creating these traditional educational silos, where if you learn how to be a nurse, that's good enough, I think that isn't good enough. And the same is true for every other profession. It really is, how do you integrate as part of a team and contribute?
Thank you, Dr. Murphy. With that note, I think this was a great discussion. Thank you, everyone, so much for joining today. I think we can leave this breakout room and head back into the main room. Thank you,
Thanks,
everybody.
Ben. Thanks, everyone. Thanks, Bernie.